Welcome back, everyone. We seem to all have times in our lives where we try to lose weight and it just doesn't come off, and we try and we try and we do all kinds of things and we just can't make it happen. I want to introduce you to Darren Scott from ChroniCare of Utah, and our special guest, this is John, who lost 70 pounds. 70 pounds. Before we get to you, John, Darren, how is this program working? Because it seems like people come in and it's an individualized system.
It is. Mainly what we do is we want to focus on the underlying cause of why the patient has gained the weight to begin with. That's really the biggest problem with most diet programs or the powders or whatever they have, is they never really found out the real reason why they gained the weight to begin with.
Oh, because people are treating it like, you know, I've got to lose the weight, but maybe habits, maybe health. Could be issues of really that's just the symptom, right?
Yeah, exactly. I mean, the weight loss, everyone thinks that's the problem, but that's really the symptom of some type of problem that their body's just not allowing them to lose the weight.
Okay, so when John came in, what did you do?
So John came in, we do extensive testing to find out that exact reason. What is that underlying cause? So in John's case, we found out he had Hashimoto's disease. And we see this a lot. There's a lot of either undiagnosed thyroid problems or any kind of hormone issues. And you balance those hormones, and it's amazing that the weight literally melts off these patients.
So John, how many years did you go before you knew you had Hashimoto's?
I never knew. Nobody ever told me that until I met Dr. Scott.
Okay, and so Dr. Scott, John said he brought you in this ginormous bag of just pills and supplements and potions and all kinds of stuff you were trying over the years to lose your weight, right?
I tried everything under the sun.
How many of us have done that? We have tried. There's your before and after. I'm almost 70 years old, lost 70 pounds. You said you still have just a few more to go. I don't know where it's going, but...
Well, I'd like to lose a few more.
Okay, so when somebody has Hashimoto's, which we've talked about this a lot on the show, what is the program that you put them on? Because maybe it's different for John than it would be for me, right?
Exactly. Everything has to be customized because, you know, you may have Hashimoto's, but you usually have some other factors that are along with that. You may have a problem with the gut. Maybe you'll have a problem with a different hormone. Maybe in your case, you don't have enough progesterone, or maybe you don't have a, you know, the female hormone balances. You know,
are you talking about my hormones? Are you saying what? You know what, with that though, with women, I understand if your hormones are out of whack, we tend to carry belly fat. Is that true?
Yes, absolutely.
See, yeah. Women, don't be so down on yourself. So if people come in and do these tests, and you can find out exactly where their imbalances are, then you help them through diet?
Yeah, so we have to do a lifestyle change with them. So there is, you know, changes to what they're eating, what not eating, what they're not eating. And then we have specific protocols we'll take that patient through to help fix the underlying cause, whether it's Hashimoto's or, you know, a lot of our patients, they're not sleeping very well, along with the weight, they're depressed.
Irritating eyes?
Yeah, yeah, cucumber therapy.
Yeah. So John, what is your program now? What are you doing in your life day to day now?
Well, he's giving me a cheat day once a week. And basically on that cheat day, I add one thing to it, and then I can see whether I put any weight on. So I maintain a 5-pound variance.
Okay.
And during that, I'm enjoying the food I'm eating better, I feel better, I'm healthy. The thing is, I'm not snoring, which my wife was complaining about. Heartburn, I had terrible heartburn, my cholesterol, blood pressure, sugar, PSA test was all up. They're all normal now.
Wow, and don't you think, Dr. Scott, this just goes back to healthy eating, healthy living, and then finding out exactly what's going on within individuals' bodies?
Absolutely. I mean, I think John, could he have done it alone just with diet? I don't think so.
Yeah.
You have to take some specific steps, and you have to really laser beam the support program so he can progress, because you're right, we treat or support him differently than we would you.
Okay, so when you have somebody that comes in and say they're pretty healthy, but they're just not feeling right, you can help them with that too?
Absolutely, yeah.
Okay. So here's the deal. If you're feeling this way and you're like, I can't lose the weight, or I don't feel right, or I don't understand what's going on, I've tried everything, there actually is some help for you that you can try. You have a special going on, right?
Yeah, for $49, you can do a weight loss evaluation to see exactly where, if you're a candidate for our program.
Yeah, so stop taking all those pills. Stop making those ginormous bags that John did. Like all those things that don't work. There's the information right there on the screen. Also go to our website at forutah.com, and we will link you there to Chronic Care and all the information that Dr. Scott talked about. See if you want to go out and see him. If they're just in Layton, give them a call. You know what, I think for a lot of people, and I know I've been on the wagon at times, it's like, it's frustrating when you want some success and you don't know how to do it. I'm glad there's people like you. Congratulations on
Thank you.
70
I appreciate
pounds.
it.
You lost a child. You lost a 70-pound child that you were carrying
I felt
around.
that way sometimes.
So good for you. You graduated from that. Okay, Glenn, what's up next?
All right, coming up on Good Things Utah, chances